Good afternoon and welcome to this event this afternoon, and it's called Local Authorities Lead the Way in the Goal to End New Cases of HIV by 2030. I am so pleased to be chairing this event today, and on the panel we have Norris Mp, who's the Shadow Public Health Minister. We also have Councillor Bev Craig, who's the Executive Member for Adult Health and Wellbeing and the LGBT lead in Manchester City Council. We also have the phenomenal Councillor Asher Craig, the Deputy Mayor and Cabinet Member for Communities, Equalities and Public Health at Bristol City Council. And we also have Councillor Philip Normal, the Mayor of London Borough, in the London Borough of Lambeth, who has done such a great job with fundraising, and Jonathan McShane, the Chair of the Terrance Higgins Trust, who this afternoon will give us an overview. I'd like to start by just saying a few words. I am delighted to be chairing this session today because it's very close to my heart. I'm a nurse by background, and I can remember so vividly as when I was growing up, some of the awful advertisements and fear and disgust and mistrust that was widely shared and accepted in society and in our press. There has been a recent Channel 4 series, It's a Sin. Looking back on this now, it seems like alien times, but it was not that long ago when gays and lesbians had to hide their sexuality. The press used outrageous language: the gay plague, the tombstone in public health, don't die of ignorance. Thankfully, society has moved on considerably, but we have yet to get to grips and actively do more to raise awareness on how we can reduce prevalence rates further. I am so pleased to say this afternoon that Birmingham is one of the 10 local authorities in the UK and one of the 300 plus international cities taking part in the Fast Track Cities initiative, which you will hear more about this afternoon. And the aim of the initiative is to achieve 90-90-90, then zero by 2030. I would like to now introduce Jonathan to give us an overview of this afternoon's discussions.
Thank you very much, Paulette, and thank you everyone for attending. I guess it's important to point out that as well as being chair of THT, I was also a councillor for many years and a cabinet member for health and social care in Hackney in East London. So I know a lot of the people on this panel through local government, but I also know the huge opportunity there is as a local government leader to take action in an area like this. As you'll know, the Hiv Commission was set up by ourselves, THT, but also the National AIDS Trust and the Elton John AIDS Foundation. And it was tasked with answering a really straightforward question: what do we need to do together to end new HIV cases in England by 2030? And importantly, if we get that right, England would be the first country in the world to end new HIV cases. So it could really lead the way globally. We know that this is something that is scientifically possible. The response from national government means that ending new cases by 2030 is now official government policy. And all we need now is a practical plan to make that happen. Or rather, I think, a national plan that supports really ambitious action in every part of the country, which is where local government clearly comes in. So the Prime Minister has backed the Commission's vision of ending new cases. The Chancellor endorsed the Commission report on the floor of the House, and Michael Gove supported the 2030 goal. He supported, in his role as Cabinet Office Minister, the interim target of reducing transmission by 80% by 2025, and he supported the idea of government regularly reporting to Parliament on progress. And the Health Secretary has accepted the findings of the Commission's report too. So clearly we need to hold the government, not just this government, but future governments, to account on these commitments. But there's also a lot that we can do at a local level. And I know that a lot of you will have read the report and you'll have seen the areas that are particularly relevant to local government. Promoting opt-out rather than opt-in HIV testing. So HIV testing becoming routine across healthcare settings, particularly we should be starting in areas of high prevalence. Local government's key role in health commissioning, not just in terms of public health commissioning, and maybe this is something we can discuss as a panel, but local government's increased role in integrated care systems and integrated care partnerships. What can we as local government do in those settings to drive more routine HIV testing across NHS settings? Partner notification being prioritised by local government, particularly in relation to key populations. Local government looking at local HIV treatment and prevention initiatives to explicitly plan and evaluate how they will address HIV-related stigma. Looking at PrEP provision, so trying to look at PrEP provision beyond sexual health clinics, and what would it look like through GP surgeries, maternity units, gender clinics, pharmacies. Getting NHS England and local authorities to collaborate even more closely on the commissioning of sexual health and HIV services to ensure that we have really seamless patient-centred care. We know that's happening in many parts of the country, but not everywhere. So what can local government do to drive that? And also working with local providers and community organisations to ensure there's much better co-delivery between drug and alcohol services, in particular being sensitive to some of the issues around chemsex. Better co-delivery between services that provide support to victims of domestic violence, mental health services, and sexual health services. So a lot of it is about joining up, which is clearly a place where local government has been in terms of its relationship with health for some time, but that role is getting bigger. So ending transmission by 2030 is absolutely possible. The Commission's report sets that out. It's a big ambition, and it does need some things done at a national level, but we're only going to get there if we do the work in every part of the country. So the Commission recommends that every area develops a local plan, but if this is going to work, then those local plans need to be just that. So take on board the evidence-based recommendations in the Commission report, but then tailor your plan to the unique circumstances in your area. We know, people who've been in local government for some time will know that local plans only really deliver when they not only respond to the particular challenges in your area, but they've been developed and owned not just by the council, but by key partners and by local people. And any plan that's developed needs to be supported by visible leadership from local councillors, from leaders and elected mayors. We're now going to hear from some amazing local politicians who are using their role to make a real difference in this area, but every councillor can play their part. And Terrance Higgins Trust will be there to help any local area develop their plans. And we think the council should start thinking now about what you can do to be part of this amazing ambition. And I said that there are some amazing local leaders who are using their role to help in this area. And obviously we have Philip Normal with us today, the Mayor of Lambeth, who is a super supporter of THD and has been for many years. And he's used his role as Mayor of Lambeth as really visible public role to tackle HIV stigma. And he, as I say, he's been an incredible supporter of us for many years, attending our events and supporting us in other ways. But I guess over the last week to 10 days, it might feel like longer, Philip, but Philip has been raising a huge amount of money for THT by developing T-shirts that celebrate the friendship and camaraderie at the heart of It's a Sin, his LA T-shirts. And I understand at the last count, it's over £100,000 that has been raised for Terrance Higgins Trust through those T-shirts. I know how much work goes into producing and delivering those, Philip. So just a huge thank you on behalf of THT and the people who benefit from our services. We are incredibly and eternally grateful. I'll hand back over to you, Paulette.
Can you hear me? Bev, put your hand up if you can hear me. It's really bad, my signal. So let me move straight on to Asha Craig.
Thank you so much, Pauline. Can you hear me?
I can hear you. Thank you, Asha.
Okay, well, thank you.
Go, Asha, you've got 5 minutes. Okay, over to you, Asha.
Okay, so thank you so much for inviting us. We've got a lot going on when it comes to addressing HIV here in the city. So I'm just going to quickly, in 5 minutes, try and tell you what we've been up to in Bristol. So in terms of the Bristol context, 870 Bristol residents are living with diagnosed HIV in 2019 and are receiving NHS HIV specialist care. Around 7% are estimated to be unaware of their diagnosis, and we have a relatively high late stage of infection, with 40% being classed as a late diagnosis, which, as we know, leads to poorer treatment, health outcomes, and increases the risk of onward HIV transmission. And we want to correct this. Some of the groups in our city are disproportionately affected by HIV. Black African communities collectively contain the largest number of people with undiagnosed HIV infection in the UK, and this is actually mirrored in Bristol. Stigma is considered to be one of the main reasons for this. Men who have sex with men continue to be the group most affected by HIV infection. In Bristol City Council, we produced a HIV Needs Assessment in 2019 in preparation for becoming an HIV fast-track city. The key findings from the Health Needs Assessment included insufficient HIV testing, high rate of undiagnosis and late diagnosis, persistent stigma, the lack of understanding about HIV amongst healthcare and public health professionals, fragmented commissioning, inadequate provision of support services to address wider health needs, the lack of availability of PrEP, and limited understanding of how changing sexual practices may impact HIV. In Bristol, we're taking something called the One City approach to keep up our activity towards these goals. Local government has its role to play, and we obviously have a vital role through commissioning, but no single organisation can help eliminate new transmissions and tackle stigma alone. So working effectively in partnership with health, the voluntary and community sector, and with our communities themselves is absolutely key. In Bristol, we were really proud to sign up to become a fast-track city in November 2019 to accelerate our progress towards ending HIV transmission. The Fast Track City is a global programme to accelerate work around HIV, and Bristol became one of the first signatories to that pledge. We are more than on target to meeting the goals of 95, 95, 95, which is 95% of people living with HIV knowing their status, 95% who know their HIV positive status on HIV treatment, and 95% of an HIV treatment with suppressed viral loads. And overarching to reduce stigma and discrimination. In Bristol, our targets are 93, 98 and 97. So we're still trying to get to that 95% of people living with HIV knowing their HIV status, but we're on track. Bristol has also adopted the UNAIDS goals of getting to zero as part of this initiative, which means that we want to achieve 0 new HIV infections, 0 discrimination, and 0 AIDS-related deaths. Our steering group is supported by Bristol Health Partners, and we have a range of partners on the steering group, including the local authority, the NHS, the voluntary community sector, universities. NHSE are also invited, but have been unable to attend so far. We have a Fast Track Cities Action Plan that has been developed to address our targets, and they are reflected in our Bristol One City Plan, as well as our local needs assessment identified.
Asha, you've got less than a minute.
Okay, so I want to tell you one good thing. So one of the things recently, Fast Track Cities has had a particular focus, as I said, on addressing HIV amongst Black, African and Caribbean communities. And we were recently awarded a £500,000 grant from the Health Foundation to co-produce and evaluate interventions with people of African and Caribbean heritage. And we launched Common Ambition this Tuesday. And just finally, in terms of PrEP commissioning and in terms of concrete local authority action, Bristol has been among the first in the country to roll out PrEP through our Unity sexual health sites in the city. And I can add a little bit more, but thank you to the HIV Commission for the work that you did. We were proud to invite you to the city, and we're taking on board a number of the issues that came out of that report. I'll leave it there.
Asha, can I thank you as per usual? You get it all in a very short space of time. Can we move straight over to Councillor Philip Normal? Councillor Philip Normal is the Mayor of the London Borough of Lambeth. Philip, over to you.
Hello, can you hear me?
I can, yes.
There we go.
Yep.
Thank you so much. Thank you so much for having me on this panel today. And what a tough act to follow with both Jonathan and Councillor Craig. The work that you do is so inspiring. So I'll probably keep this quite short because so much of what you've said I would just be repeating. It's just absolutely fantastic, everything you're doing. So I became, in April last year, the first openly HIV positive mayor in the country. And one of the reasons why I did that is because we have to discuss HIV in the public. We have to make sure that in order to tackle stigma, we take the shame out of being HIV positive. So that's why I decided to do that. I was diagnosed in 2005, and I've been on medication for 9 years. And I'm really enjoying having these conversations with members of the public that wouldn't normally talk about HIV, and it's people have stopped me in the street going, it's great what you're doing. They just didn't know. So that's been wonderful. So yes, I've been raising money for the Terrance Higgins Trust, and I've been blown away by the response to the It's a Sin t-shirt, and it really resonated me. And when I first made it, I really honestly thought I would sell about 5. So I'm really proud that we have now sold over 5,000. So I'm going to be really quite busy. And that has raised over £100,000 for the Terrance Higgins Trust. And it really is brilliant because it supports the vital work that they do. Councillor Craig, I really welcome what you said about the work that you're doing in Bristol, and I'd really, really love to hear more. And you're absolutely right that we need to work together with our national and global partners to stamp out new HIV infections. For example, I really do believe that we should campaign for the prevention drug PrEP to be in every pharmacy in the country, like not in just metropolitan areas. I think that work would be incredible and just have a huge impact on our communities. And as local councillors and in local government, one of the reasons why it can be, why we can lead in stamping out HIV infections is because we have worked with our communities so closely, and we understand them better than national government. I will talk later probably about some of the work that we've been doing in Lambeth, which I'm really, really proud of. So yeah, if you haven't watched It's a Sin, I'm assuming all of you has. I won't give you any spoilers, but it's, you know, brilliant and beautiful television, and it's got people talking about the reality of what it's like to be HIV positive today. And like I said, when people are stopping me in the street talking about it, I mean, how wonderful. So it's really good to look forward on and talk about how you can't pass the virus on. If you are on treatment, you can expect to live a long and normal life. So it all starts with a test. And I think this has to be one of the most successful HIV testing weeks we've ever seen, but we have to take it further and make sure that it's not just about this week. Everyone can access a test.
Can I say thank you, Philip? That was really, really heartfelt, and you are spot on. Everyone can access a test, but sometimes it's around the stigma and the fear, but we need to remove that, because you know something, it's an illness that we live with, just like people live with cancers and other things, and it has to become that way. And with people on the panel today, that's very much taking it that step closer. So thank you for your contribution. Can we move can we move swiftly on to Bev? But before Bev starts to speak, can I ask again, can you ensure that you're tweeting the hashtag, what is it? The hashtag is LabLocal21. Any questions, please put them into the box. If you're going to give any personal stories later on, can I ask that if you don't want it recorded or you don't want it published publicly, let us know at the beginning of your remarks and we will ensure that we remove them. Okay, so Bev, over to you.
Thanks for that, Paulette. And I just want to begin by saying it's great to be here, and it's great to follow, I think, such fantastic speakers. What I particularly like about this week when we shine the light on local government is we get the chance to big up the work that we do in our communities in a way that we don't always get across in politics very succinctly. So great to be here, and great to see the Commission producing its report. I was pleased to welcome the Commission when they came to Manchester. Gosh, was it last year? It feels like an eternity ago in terms of the last 12 months that we've had. And I suppose just quickly in terms of a Manchester perspective, we've obviously as a city and a city region come a long, long way from 1985 when 6 gay HIV activists set up the Manchester AIDS line. Which was funded and supported by Manchester City Council, and in 1985 we set up the AIDS working group in the city. So I definitely, as a local member, stand on the shoulders of the many activists and councillors that have gone before me, I think, in transforming the way that we talk about HIV and AIDS in our city region. And as a city region, we're really proud to be part of the fast track city network that Asher and Paulette have talked about before. And indeed for us, it built on our Hiv campaign, the Ending HIV in a Generation programme of work that we'd signed off through Greater Manchester Devolution to invest an additional £1.3 million in the work that we were already doing. And I think just in terms of where we are as a city, and I'll come on to what next and some of the big things that I think we really need to focus on. We're seeing, like many other areas, a concerted and focused effort, particularly on hitting those UN AIDS goals. And where we sit in Manchester at the 91, 97, 97 figure is really focusing now on people that don't know their status, and the work that we've been doing across all of our communities that we know are at increased risk. We've got great campaigns that I'm sure we could talk about in terms of our SORT HIV campaign we've done across the city region, the Positive Speakers programme that we've had through the George House Trust, that we've funded and supported to get into not just statutory services, but schools, charities and organisations across the city region. But I think what I like most about the Commission recommendations is the ability to knit together the critical importance of ownership that the government has to take in introducing and funding a lot of these initiatives nationally, but knits with it the local leadership and local knowledge of our communities that we can bring, because I think both are equally vital. And we've seen in the COVID pandemic, when you take national will and national resource and you knit it into public services and the voluntary and community sector locally, you see local systems at their best with the communities that they know best. So I think in terms of quickly some of the next steps and the challenges as I see it. So in Manchester and Greater Manchester, we've obviously been working on our local plan and how that fits across to the Commission's recommendations that we've been through. And I think I simply cannot overstate the role of areas, localities, local authorities, integrated systems, all of the different partners that they play in tackling the stigma that comes with living with HIV. You know, we've always had a campaigning role as a local authority in a city, and I think that still remains vitally important. I think also normalising testing is one of our biggest challenges. So COVID has slowed us down, but we're working on business cases to get opt out rather than opt in testing front and central of what we do. So we're looking at how we introduce that across all Manchester hospitals and working with primary care to make sure that some of those things are indeed normalised. And I suppose the final thing I'll say is that now is not the time to disinvest from the vital support services for people living with HIV that we need. In a city like Manchester, with the poverty levels that we have, over half of people living with HIV are living in our most deprived areas, and over a third of those people are over 50. And we know that for people diagnosed 20 years ago, the financial challenges facing them when they were told to leave their pensions and quit their jobs live with them to this day. So I think the support that we do, particularly with voluntary and community sector organisations as local authorities and as integrated systems, is absolutely vital. And then the final thing I'll say as I'm approaching my 5 minutes and Paulette moves to cut me off, is that this absolutely has to sit at the very heart of the campaigning that we're doing as the Labour Party around public health funding and investment. You know, we see fantastic services day in, day out, effectively done on a shoestring. And until national government step up and fund services the way we need them to be funded, the benefits of local government are absolutely fantastic, but with one hand tied behind our back, we'll never fulfil our potential.
Bev, absolutely phenomenal and actually on time. So thank you for that, Bev. And yet again, I am going to ask, if you have got your phones with you, you're on Twitter, please hashtag, let me get it right, LabLocal21. We are now going to bring in, don't tell anybody, my favourite MP, which is Norris Mp. He's the Shadow Public Health Minister, and he's really, really good at this role. And I feel I'm not just saying this, but he really gets it. So Alex, I'm going to go over to you. Thank you.
Thanks, Paulette, and thanks for that kind introduction. And it's a pleasure to follow previous panelists. And you know, I would always say that I am previously of local government, and I think in my mindset I've never left. So if the question that we're dealing with today is can local government take a leadership role in this critical area, then the answer is yes. You know, I got elected to Parliament, so I want to give powers out to our communities away from Westminster. And I think this is a crucial area of public health leadership where our local communities are best placed to do it. I just wanted to kind of just follow on from a point that Bev made about standing on the shoulders of heroes before us, and we are. And if you look at It's a Sin, you know, that's in the lifetime for probably most of us on our call. That was a time when meetings like this, gatherings like this wouldn't have happened. Instead, there was stigma, fear, discrimination, and hatred. And the fact that we're so freely able to assemble today to talk about this is because of what's gone before us. And so particularly, I just wanted to acknowledge Terrance Higgins Trust as obviously a sponsor and LGBT plus Labour too, because all throughout that 40+ years you've been there doing that and providing those safe spaces and that life in the darkness. And whilst that is incredible progress, mate, we shouldn't forget that and forget to recognise it. I'm here to give a full-throated commitment from the Shadow Health team, from the front bench in Parliament, about our commitment to reducing HIV transmission by 2030. It's something the government are committed to, and we're going to be holding their feet to the fire on. But critically, it's something we intend to do in government. And that will be me and my colleagues who are there at the moment. We might have to pinch a few of you along the way to be amongst that parliamentary Labour Party that does it. But this is not a theoretical exercise. This is something we're doing in our communities now with Labour in power in local government, and we will finish off in government ourselves. Now, I'm always just tempted to say we'll just do what the HIV Commission said, because I think the recommendations are brilliant and I don't disagree with any of them. But I just want to highlight 5 things that we're particularly pushing for at the moment, all of which I think have an important local dimension, or indeed are better led locally. But firstly, opt-out testing, making every contact count. The number of tests we could do if we just switch it to the norm to test rather than to app to test would make a massive difference. So as you're leading, certainly in new waves of health and social care integration and looking at ways to make things better, please fight for that, because I think that would make an extraordinary difference in finding out those who have but don't know. Secondly, to riff off the points made by Jonathan and Philip around PrEP. PrEP is just like any part of the basic healthcare that individuals access through our wonderful National Health Service. And the basic principle should be that you access that where you access your healthcare services, where your preference is. It shouldn't be, right, if you want this, you go to a GP. So whether that's your HIV clinic, sexual health clinic, whether that's your pharmacies, as Philip says, I think that I don't think we can say enough. We need PrEP to be there. And there's a massive, and this is where the local dimension comes in, there's a massive health equity issue otherwise between the cities and those towns and rural communities that perhaps don't have the same level of sexual health provision. So, having local action plans to ensure that, I think, is absolutely crucial. Action on late diagnosis, particularly to take every late diagnosis as a critical incident and to find out, not to make that's a problem that's on that individual and to blame an individual, but to look at what the societal, environmental and cultural barriers were to that person knowing and sharing their diagnosis. And in doing that, that's how we continue to improve services. Fourthly, on the basis that we haven't finished this, it is great that we can do what we're doing today and to talk freely about this. And, and as Philip says, the way in which the conversation's evolved, but there's still lots and lots of stigma out there. We need a massive public level anti-stigma campaign that's then, because we know you do this best, that's then reflecting in your messaging to the different communities that make up your parts of the world, so that we're landing that message effectively. Anti-stigma, but also awareness around it. This isn't, don't watch It's a Sin and take the message that this is something that happens solely to gay men. Watch it and think, what was it in British society that allowed that stigma and hatred to exist? What did we have to do to change that? What does that mean for us today, particularly perhaps around trans rights? But don't take the message that therefore it only happens to gay men. So if you're not gay or a man or one of those things, it can't happen to you, because we know that in that kind of lack of knowledge is so much of the risk. And then finally, bringing up mental health services properly to wrap around individuals who need it. But all of this is in a context of public health cuts. And before I finish, Paul, I'll just quickly mention public health cuts. We know that you guys are doing an incredible job to try and get the best out of what you've got. We know that you're not being adequately resourced to do it. We know that the demand-led parts of your public health grant, certainly around drugs and alcohol, other parts of sexual health around the growing pandemic of STIs, is putting loads of pressure on the things that you do, and it's pushing out a lot of things that are evidence-based and good interventions. So we're fighting as hard as we can at a national level to change that, not only to restore the money that's lost, but to have proper money going into the communities with greatest need to up that too. So as I say, these are not theoretical things, these are things we'll do in government. But my final thought, Paulette, is that if we look at It's a Go on, I'll be dead quick. If you look at It's a Sin, but the thing for me is, if you looked at It's a Sin and thought, God, I'd like a friend like Jill because she's cool, funny, empathetic, there for you in your darkest moments, that's fine. I think we'd all share that. But the point for us is not to have friends like Jill, but to be friends like Jill. And, you know, I know that through our collective efforts at a national, local level, we can do that. Thanks, Paulette.
Fantastic. As per usual, I love to hear you speak, Alex. Your passion is just there for all to see. Now, the first question, trust me to lose the questions as soon as I must. 1 second. Right. The first question is, HIV Commission calls on every area and every service to help fight HIV-related stigma. Where would you start? Now, I'm going to ask Asha and Bev that question because of your authorities. So, Asha, I'm going to ask you first, and then Bev, if you'd like to add a few words.
Could you repeat the question, please?
I can. HIV Commission calls on every area and every service to help fight HIV-related stigma. The question is, where would you start?
Where would we start? Well, we've already started. Yeah,
I know, that's why I've asked you.
Okay, so one thing about Bristol, we're not resting on our laurels. Like I said, stigma is a major issue for us in the city, particularly amongst the certain communities. And so with the launch of our new Common Ambitions project, I mean, it was no mean feat that through the partnership of the Fast Track Cities initiative, we secured this £500,000 to set up this project specifically targeting Black, Asian and minority ethnic communities. But I think it is about making the conversation okay. You know, I was moved on Tuesday at the launch of Common Ambitions when a poem was read out, and the poem was, you know, it said, you know, three initials do not define me. HIV does not define me. And it's really about how we make HIV normalized, having those conversations, bringing them into schools. So we're going to put together a kind of a range of, through the action planning and the work that we're going to be doing, we'll be setting out quite clearly how we're going to start having those conversations in schools, through community, voluntary community sector organizations, through church and faith leaders, bringing them to the table and having those conversations to ensure that we're getting the message out there. And just, you know, like reducing taking away that stigma. And it's important, particularly for me, particularly as a Black leader, to actually also lead on that call. So myself, you know, kind of Marvin, we're very proud of the fact that, you know, not only are we a signatory, but we are prepared to kind of drive this agenda and actually lead on this. So I'm proud to be a kind of champion for HIV, the Fast Track Cities initiative, and I'm not afraid to stand up and be counted and get the message out into the wider community. So, but it's also going to need resources and funding. We started Fast Track Cities with little and nothing. The funding that we got for Common Ambitions is by the by, but I think it's a concerted effort of all of the partners who make up the partnership that we can use all of our all shoulders to the wheel, all our comms efforts across the council, NHS, CCG and others to really launch a campaign similar to, I suppose, to what we're doing around vaccines and COVID-19 at this moment in time.
Right, thank you for that, Asha. Can we move straight over to Bev? Do you want to add anything, Bev?
Yeah, I suppose the things that I would add is probably reflecting on where we're at, and if areas were coming perhaps to this a little bit more fresh than some of the histories that we have in our cities, kind of things to think about. So I suppose for me, when we talk about tackling stigma, it's quite important to break that down into what we actually mean about that. So I think there's the component that we've already touched on around normalising talking about HIV, normalised testing, and where you might focus your energies in bringing some of that change about. So I think work with the cross between local authorities and health partners. So the role of integration and joint relationships and partnerships, I think, is really key in bringing some of those conversations about. And I guess how you work with public sector organisations to tackle their own organisational stigmas, or often it's lack of confidence in talking about things. We find this with primary care all the time. You know, we've used our positive speakers campaigns to go in and tell their stories to GPs, to health professionals, around equipping public sector organisations to feel a bit more confident. But the second bit that I'd talk about is absolutely the relationship with communities and the importance of community voices and how they can complement the role that healthcare and public sector organisations can play. And I think having strong local partnerships, you know, in Greater Manchester, we've brought together what were traditionally quite separate campaigns around bringing together the likes of the Black Health Agency with the LGBT Foundation, with the George House Trust, and building a coalition really, who's able to amplify community voices, but also advocate for community specific both initiatives and work to be done. So I think there's a lot we can still do, but I would think about it in terms of working with services and what you want to change, working with communities to understand and to amplify their voices, and then working with wider society, which is one of the things that we did with our SOAR HIV campaign, which was that broader kind of comms approach to trying to normalise it. So it's multifaceted, but just being clear in what you actually want to achieve and what we mean by stigma.
Paulette, can I just quickly add as well? I think what we also have to do, you know, we know that HIV care has to be part of a longer term national health strategy. If we're really going to reduce stigma and normalise testing, it can't just be about sexual health services.
And this is why I wanted to bring, if you don't mind, I wanted to bring Alex in, because I wanted to ask Alex, as part of a government policy, what do you think, Alex, we need to do at a governmental type level, at a parliamentary level, to actually reduce stigma? If there's anything we can put into policy, what is it that we can do?
Well, look, you know, I'm always quite kind of skeptical of big national level government communications programs, but I do think a big anti-stigma campaign, as I said, would be helpful, but only if it's delivered properly locally through local channels that work and, you know, in a way that's tailor-made to reach all of our communities. But actually, there's a little bit, and I'm at risk of being a bit unfair, given that the government have committed to, you know, the 2030 commitment a lot more quickly than we thought they'd do. But what would be great, and I think the experience of PrEP was a really obvious one, of kind of dancing around something that they knew was the right thing to do, but they were a little bit worried about doing it because they thought it might send a difficult public message around what they would say were lifestyles, which is obviously not what we would understand through PrEP. So what would be great for them would be for them to be full-throated when they do these things, that these are just normal healthcare interventions just for anybody in a way that anything else is. That's just your way of sending that really clear national signal that they don't differentiate either, and this isn't something that's different or odder, because that's the sort of area where stigma grows. So those are the sorts of things I'd be looking at.
Alex, can I push you a little bit before I bring some of the others in? And the second question I had, which I think you've started to answer really, so that's why I'll come back to you first. It says local government is delivering the national PrEP rollout in England, but only through sexual health services. What areas consider pilots with GPs and pharmacists to tackle health inequalities and increase access to ensure all communities at risk can access this HIV prevention drug?
Yeah, I mean, I just, as I kind of said a little bit earlier, the thing about healthcare is you should access healthcare where it works for you in your life. If you're really committed to universality, and particularly on something as important as this. So, you know, the idea that it could be boiled down to a single centre and site, which we know aren't going to be evenly distributed, which we know will create regional and particularly city and town and city and rural health inequities is just a bad idea. So hopefully perhaps we can prove that concept locally around actually the more the merrier. There'll be some like many colleagues, I'm frustrated we haven't got the vaccination programme in pharmacies yet, and we're pushing hard on that regarding COVID. But there are good reasons around storage that mean that that's the case. There are no such reasons here. The only reasons are reasons of imagination. So I hope we'll be able to prove the concept locally and get that nationally to be the norm as soon as possible.
Fantastic. Can I come to Philip now, please? Because there's a really interesting question in the box. It says, there is sometimes a disconnect between HIV services and other interrelated services, such as drug and alcohol services. Testing provided by substance misuse services works. What are your thoughts on that point, Philip?
I think that's an absolutely brilliant question, and something that Bev mentioned earlier is about having community voices and strong local partnerships is vital in tackling stigma. It's vital in tackling misinformation, and if it gets people talking about HIV, then they're more likely to get a test. So just to touch on that, yes, one thing we're doing in Lambeth is we have what's called a social impact bond. So it's Lambeth, Southwark and Lewisham that have signed up with and it's alongside, it's done with the Elton John Hayes Foundation. And through this, we've managed to work with our hospitals and work with our local communities to engage people into healthcare services where they wouldn't normally be engaged, so that the outcome is to really, it is a social outcome. That's what we want to achieve with the social impact bond. So far since 2018, we've got 274 people into care that wouldn't be in care because of their HIV status, and that's 140 people were diagnosed, and this is through our hospitals, through our clinics, that wouldn't normally get a test, and 134 were re-engaged into care for one reason or another. And obviously there's multiple factors that can play in why somebody would not be engaged. We've had more than 146,000 HIV tests because of that social impact bond, which is great. But it's because of that social work that we're doing and working with those community groups that we've achieved that. So I'm really proud of that in Lambeth.
Brilliant, brilliant. Now we've had a really interesting question, which I'm going to throw out to the panel. What role can BLPs and CLPs play in helping local authorities, and what would be the first step? Could I start with Bev with that one, please? And then I'm going to go to Jonathan. I'm not sure if Jonathan can answer this one, but I am going to ask him. So Bev, you're first.
Thanks. I think it probably speaks to 2 points, actually. The first is broader awareness raising, and fits nicely onto some of the tackling the stigma points that colleagues were making in the last question. I think we also have to recognise that no society is immune to stigma, and that we may have to challenge within the Labour Party. Perhaps, there are areas of our party that may not be as well educated or as well equipped to talk about some of the issues facing people with HIV. So I think in the first instance, it can be a really useful campaigning tool about making sure that we educate our own party members and our own local structures around some of those issues. And then the second, of course, is a relationship between your local campaigning party and what you can get your local council to do. So I think, particularly if you live in an area where there perhaps isn't the visibility of some of these issues that you would like to see raised, I think it can be a really useful tool in bringing people from your own party on side in a way that is able to move them further into action. So I think it is useful, but I would, and I would say this as a cabinet member, I think kind of change comes about when you can have the party actively campaigning in a way that can lever your council or your area or your mayor or your MP into raising their voice on this. So I think it has to be quite collaborative, but I would definitely see it as a very useful place. You could even have speakers at constituency Labour parties talking about their experience of living with HIV or the campaigns that have been run. So I think it's a really, really helpful point. I'm sure LGBT Labour would be able to help with this as an organisation in terms of putting you into contact with some people that can help, because all of our constituencies and branches, we could do with talking about lots more of the issues that impact on our lives on a day in, day out basis than perhaps kind of ideological debates of the past. So I think it's a really, really useful campaign.
Thank you for that, Bev. Jonathan, I'm throwing you in at the deep end. What would you like to see BLPs and CLPs doing in this area?
I think Bev's completely right. I mean, obviously, a number of the areas represented by councillors today will have really big local party memberships, and the sort of people who attend Labour Party meetings are often active in their communities, but they won't, as Bev says, they won't all have a great knowledge and understanding in this area. So it's a really good opportunity to get people who are active locally to understand what's going on in this space and what can be achieved. It is a good way of we talked about holding national government's feet to the fire and these big ambitions. It's important that local government is held to account too. And I think Bev's final point is exactly right. It's no bad thing in the current Labour Party, I think, to come together on an issue that reminds us why we're involved in progressive politics and what unites us rather than divides us. So it feels like quite a straightforward way of increasing awareness. As I say, amongst a group of people who are particularly active locally, that could be incredibly helpful. And I'm sure a number of the organisations, LGBT Labour in particular, involved in today's fringe could help local parties make that happen. And I guess it kind of finally relates to the point Bev made about community voices. We've heard someone talk really passionately about late diagnosis. That's so much more powerful than looking at, for example, late diagnosis figures on a graph. So there is something about getting people to talk about the impact of issues on individuals, on their lives, rather than in the abstract. And that could happen through branch meetings or CLP meetings.
Right. That is fantastic. Now, I've got two questions that I want to throw at you, but what I'm going to do is I'm going to say both questions and I'm going to give each of you half a minute to say something on both before we round off, which is not a lot. What exactly does the panel think we should be doing around education in respect of HIV, especially within areas that Alex has mentioned that are rural and semi-rural, where the testing provision is patchy or hard to access? And the final point was in the chat box, which I can't, it's slipped, gone up. It was a really good point. I'm not sure I'm going to be able to get back to it. It was about the House of Lords has now implemented some policies, and how long will it take to get back into power? I can't find the question. So what I'll do is I'll get the one from the question and answer box. No, I've just had it. So the last question will be the question I've just given, because unfortunately I've lost the other one while saying this one. So let me start with Philip. What are your thoughts on that point?
With the first one, I think when we are looking at tackling, say, stigma around HIV, but also other health issues, it starts with education in schools. It really does. And I grew up in the shadow of Section 28, where there was no discussion of LGBT issues at all, even from a health point of view. So I mean, it's thanks to the campaigning of, the Terrance Higgins Trust and others, that this government is finally rolling out inclusive LGBT education, sex and relationship education this summer. And we need to make sure it's implemented properly. I'm sure that's probably 30 seconds, but it just has to include HIV, women's issues, and equality.
Brilliant. Does anybody else, one more person, want to say anything? Asha, on that one, then I found my other question, so I'm going to ask it. Asha, over to you.
Thanks. So I think that just following on from the point that was made, not only about good education, better links with schools, because we have to ensure that the narrative is right on this, but we also need to be better engaged with refugee and migrant communities, individuals and organisations that work within our communities, that maybe not are HIV specific, but we just need to get the message across in every way we possibly can. And I said before, use some of the services that like substance misuse services and others. Again, use different services to get the point across and the message across.
Right, unless anybody else wants to say anything on that one. If Alex has got back onto the call, I desperately want to ask him this one, so I'll read it out quickly. And anybody else who wants to come in. With the impact of the National Party being a mess for 5 years and the red wall falling in 2019, what is the realistic and achievable for campaigning groups within the party who are in opposition and have no MP or MEPs and a small council group, if at all? Alex, and the second one is the House of Lords Select Committee on HIV and AIDS report of session 2010-12 includes many of the recommendations in the HIV Commission report. Will the latest report translate into more action?
Yeah, just to do them in reverse order. Yeah, I think so, because the difference between the Lords report and the Commission's report was that the government have immediately accepted, well, they've certainly accepted the global goal, and there'll be some negotiation that we'll be working them pretty hard on around the detail and accepting the things. I mean, there's things in there it's hard for a sitting government to accept, especially around public health cuts and their culpability in that. But that's why I think we should be more optimistic about that. I mean, I might skirt my views on the last 5 years because I'm going to look on the next 5 years, really. So it's two things. One, we can change things in opposition. This is exactly the sort of campaigning issues that we can go on and we can affect change. That's a great thing. Two, if there are many parts of the country, which is why we're in opposition, that don't, as you say, have MPs or don't, are relatively small Labour groups or no Labour groups. Well, one of the things that has really changed over the last year is how much better we are at this stuff. So, if you need frontbench speakers for your meetings, it's much easier to get. So please ask. I certainly will say yes. I say yes to any I get. So, we understand that it's sometimes in a big city, and I know, on the call we've got Councillor Rebecca Langton from Nottingham as well. And it's a bit easier for us because we've got the assets that we've got. But actually, use us too. So please just call.
That is brilliant. Does anybody want to say a few closing words before I close the session? We've got 2 minutes. I'm really aware that Bev didn't get an opportunity. Is there anything you want to add, Bev? Otherwise, I'm going to close the session.
Yeah, no, I'd just say really briefly, I think in terms of the point, particularly about different areas of the country, I think the trick is not losing sight of the fact that we have targeted work and targeted messages with specific communities, but that there has to be a universal message and a universal education that applies to all communities so that nobody gets left behind. And then the second is that I'm sure any of us on this call would be happy happy in more detail to talk about the work that our areas are doing and any learning that we have. So I'm sure on behalf of all the participants, I'm sure we'd all be happy to have our details kind of circulated if people wanted to get in touch.
Brilliant. And now to just round up, I'm going to go back to Jonathan. Jonathan, what's next and what can Labour do to help the Terrance Higgins Trust to meet that 2030 goal, should I say?
I think I'd turn it around a bit and say that, you know, we really want to help people in local councils, local leaders, to develop a local plan that underpins this national commitment around 2030. I think often in the past, when I was a cabinet member for health and social care, big national charities would sort of demand that you had a strategy and something, and then they'd name and shame councils who hadn't written their strategy yet. I think we want a completely different approach, which is recognising the constraints that councils are under and trying to persuade them that this is something they can get behind. It's something that we can achieve. You know, on your watch, you could be part of ending the new transmission.
That is absolutely incredible.
To do that.
On that note, we are going to have to end the session. Can I say to everybody, you have been absolutely brilliant this afternoon. I've thoroughly enjoyed this session and we need to do more of this. So enjoy the rest of the conference. And on behalf of the LGA, myself, the Labour Party, thank you so much for your input, everybody. And bye-bye. Take care.